Welcome to the Seattle Children's SDR channel. I'm Dr. Sam Browd. I'm a pediatric neurosurgeon here at Seattle Children's, and today we're going to walk through the surgical procedure of selective dorsal rhizotomy, or SDR. Selective dorsal rhizotomy takes about 3 hours. I think of the operation in two parts. There's a preparatory phase where the children are coming into the operating room. We're getting ready for surgery, and then there's the actual operating portion of the procedure. I'd like to walk through and discuss how we do this. Once your child comes into the operating room, anesthesia is started. The child is positioned face down. Neuromonitoring then comes in and they connect electrodes to your child's muscles. The reason for this is we're able to then very accurately determine which nerve connects to what muscle group. And that allows us to do the selective portion of the rhizotomy where we know exactly what we want to cut to treat your child's individual tone issues. Once the monitoring is set up and we're ready to begin, we've identified the level that we want to enter, and then we begin surgery. We open the skin, we expose what's called the lamina, or the back of the vertebra. This is then removed, and we're looking at what's called dura, or thin leather type material that covers the spinal cord. The operating microscope is brought in at this point, and we open the dura, then we're looking at all the nerves. What we do at this point is the actual core of the operation, and we begin by stimulating the individual nerves. We're able to determine a difference between motor and sensory nerves, and then what we do is when we stimulate a sensory nerve, we look to see if this is a nerve that's affecting your child's tone. We have all of the preoperative evaluation in the operating room. I'm talking during the surgery with the rehabilitation doctor who's familiar with your child and the specific issues that we're trying to address with surgery. And we go one by one through all of the nerves. Typically, we're going to section about 20 nerves out of about 70 that are tested during the operation. Once we've done that, we need to close up and complete the operation. This is done by bringing that thin leather material back together, the dura, and sewing it watertight, closing the muscle and skin layers above that, and then coming off of anesthesia. Typically, once we're done in the operating room, we'll be in the recovery room for about 1 hour, and then your child will come back to their regular hospital room.